Today, we're going to be talking all things aesthetics. Now, as you know, if you've watched my videos, I'm obsessed with skincare. And I am an aesthetic clinician myself, but I only do Botox nowadays. I used to do a bit of fillers, but not anymore. And there is a whole world of aesthetic procedures and tweakments out there. And I have found another doctor who I brought with me today. This is Dr. Sanam, and she herself is an aesthetics doctor as well. And I've been desperate to ask her loads of questions about all the different procedures she does, what it all is these days, what can you get, what difference does it make, side effects, risks. And I've resisted asking these questions because I thought this would make a great video. If I, age 45, want to know all these questions, I reckon you might want to know the answers too. So hello, thank you for coming.
Hi, so I'm Sanam. I'm one of the doctors. I work with Sophie in GP, but I also run my own aesthetics clinic in Huddersfield. So we thought we'd get together and have a chat.
Yeah. So how long have you been doing aesthetics? I don't even know
Just over a year now.
Ah, right. Yeah. Okay. And you're always kind of doing courses and learning lots, aren't you?
Yeah, that's the best thing about aesthetics. I find it fun because it's never ending. The learning is
because that's part of the thing. It's the speed of which there's new things on the market as well, isn't it?
It's so hard to keep on top of. I don't have people do it.
Well, that's what I want you to kind of give us the overview today. So obviously Botox and fillers is kind of the most common thing that people have been doing, and that's been going on for years.
Yeah.
Is that still the most common thing you do?
Actually, no. I found the trends have changed so much, even since I started just over a year ago. Botox is still there. It's untouched.
And I guess we should say, when we say Botox, that's a brand name, isn't it?
It is the brand I use, so I can use it. but
I don't use actual Botox.
Yeah.
But it's a brand name. But it's botulinum toxin, isn't it?
Yeah,
but
anti-wrinkle, as we refer to it.
Anti-wrinkle injections.
Yeah, so they're still steady, top of the market. But then there's been a big shift in trend from fillers to more regenerative medicine.
Oh, tell me about that.
So people don't want fillers as much anymore. If they do, they would just want tiny tweakments.
Yeah, because I guess like probably 10 years ago or something, there's so many celebrities with like guinea pig cheeks and
or the pillar face or
overdone lips.
Yeah,
so that's out of fashion now.
That's way out.
Good.
Yeah, we don't want that anymore. We don't want that anymore. No. We don't do that.
That's the thing for me. And when I've spoken to my clients, it's always about like looking completely natural. In fact, I always say to people, I want someone to kind of walk past you in the supermarket and think, has she been on holiday or is she getting great sleep? She looks amazing, rather than she's had something done.
Yeah, absolutely. A lot of people I get come into clinic is because they've been referred by other people and they're like, oh, I didn't know she had this done. And that's exactly why.
So what's the most popular thing you're doing at the minute?
Oh, well, so like I say, anti-wrinkle still at the top, but then I do a lot of skin boosters, a lot of polynucleotides, which I know you've questioned me about. A lot of other things like collagen stimulating therapies like Sculptra, HIFU, device-based.
Okay, this is what we need to talk about because I don't actually know what any of that means. Yeah. So I have done a short video about polynucleotides because I was interested. I was like, well, this sounds interesting. Because as I'm 45 now and I've never had filler, I do baby Botox. But my neck is starting to look like an old lady neck, and my jowls I'm noticing are falling down. So, I do wonder what would I consider? I'm also nervous as well, though. So when I looked into polynucleotides and discovered it is the injections of actual salmon sperm DNA into your skin, and there's no long-term data to say it's safe, I was nervous.
There's no long-term data in aesthetics, but what we're forgetting is it's been used in regenerative medicine, in scar healing, in actual medicine for many years before in aesthetics. So it's been used in MSK for joints and inflammation. It's been used in plastic surgery. Yeah, in polynucleotides. It's been used in plastic surgery for scar healing and regeneration. So actually, it was only brought over to aesthetics after being used in medicine.
Which is often the way, isn't it? Which like Botox was as well. Okay, and so tell us about polynucleotides then. So
polynucleotides, you're right. It is DNA from salmon sperm, or in some cases, trout DNA, depending on the brand.
Preference for fish. Salmon or trout? Sperm, what's your preference?
Yeah, and they take the DNA molecules and mix it in with lots of other fun stuff to help, and they make a little cocktail which essentially helps with regeneration. The concept is polynucleotides act on 4 different layers. So they act most superficially on your skin to help with the collagen and elastin reproduction, but they also strengthen the vascular epithelium, so the blood supply wall, to make sure that you're getting the good nutrients to the layers where you need. And then as we age, two of the main signs of aging are fat loss and bone resorption once we're into our late 50s. And polynucleotides, when started early enough, they help stabilize your fat pockets and also your bone.
Your bone? It affects your bone?
It works. So studies have shown that they actually work on all 4 layers. So they can't stop what's already, or grow back your bone or your fat, for example. So what you've already lost is gone. But what they do is help stabilize them for a bit longer.
I wonder if that is marketing that's been, like studies done by them going, no, you better start soon. The sooner the better. Don't wait. Pay us your money.
Well, it is. I mean, even in medicine, prevention is better than cure.
Yeah, it is true. Okay, but when I looked at this, it was a very subtle difference, isn't it?
Of course, but that's
Can
why
you
people
actually see
like
a kind of before and after?
That's
you
why
notice?
people like it, because it's subtle.
Or does it take time?
It does take time. So because the only thing in aesthetics that is immediate is filler, which is why people loved it.
Yeah.
Because we're impatient. We live in a society where we want results and we want them now.
Yeah.
So filler's the only thing that does that. And then you have your Botox, which even then people are impatient with Botox. You'd be surprised. 2 weeks is too long to wait.
Yeah.
So something like polynucleotides or all your other treatments, they take from 6 weeks to anywhere to a few months to work.
All right. And how long do they last then?
So it depends on the treatment. With your standard polynucleotides, after you've had your loading course, which is 3 treatments, you then need to top up every year or every 6 to 9 months, depending on your age and what your starting point was.
Oh gosh! And where do you do it?
Anywhere. So it can be used anywhere. Your under eyes, really common. Face, neck, again, very common. You can actually also use it on your body for scars, stretch marks, hands. Anywhere really.
You are selling it quite well, because I guess I used to do some under eye filler, but I was always really nervous about it because it is a bit of a dangerous area. So is this a bit safer?
It's when you're done properly by someone trained properly and using a cannula, the risk is substantially lower. But the thing with tear trough filler is there's very few candidates that are actually right for the treatment.
Yeah, because again, you see celebrities. I think who was it? Jennifer thingy from Friends. I forgot her name. And she overdid it, and then you can
see the blue tinge under the skin,
and it goes out instead of
because it needs a trough to sit on, which is why it's called tear trough filler.
Yeah, so if you don't have,
I have a trough and I have tear trough filler.
Maybe I don't.
You don't have a trough,
right?
And therefore that filler would.
You have tear trough filler?
I do.
But that's like a good question actually. So what? Yeah, maybe you can tell us what you have done.
Yeah, so I have baby Botox. Actually, I do half the dose.
And how
on myself.
Can we ask how old you are?
Oh yeah, I'm 32.
Oh, she's so young. So you're 32, okay.
So I have,
and you're already
Botox for the first time this year,
right?
So I've had it twice so far.
Because it can be kind of preventative, can't it?
Yeah. And I was starting to see the lines, not in my skin at rest, because the whole goal is we don't want to get to the lines at rest, because that's when it's too far. The skin damage is already done.
Yeah.
So I started with a little dose of Botox earlier this year when I hit 32. And then I got my tear trough filler because I have a very deep trough and very dark under eyes. I guess part of that is my Pakistani genes, and then part of it is I've been wearing glasses since I was 9, so
and you work 7 days a week.
That also. And I've been doing that since I was 17. Right. So yeah, we've been a workaholic forever. And so I do have the deep dark under eyes, which I have been working on with polynucleotides, with the tear trough filler, and it's been day and night difference. And then I microneedle my skin every 4 to 6 weeks, just to help with general skin healing. I've got some sunspots. I lived in Bulgaria for 6 years in 40 to 50 degrees heat through the summer, so I do have some sun damage despite wearing my SPF every day. So I've been working on that with
so
some
the needling helps that,
and microneedling.
Microneedling. And so what does that entail if someone comes to you for that?
So microneedling, the actual treatment,
yeah,
so it comes in a little pen device. You've probably seen them, Dr. Pen. There's lots of different pens available, and then you attach a little cartridge on the top which has microneedles, and you just treat the whole face.
Roll it on.
It's there's different pens have different protocols. Some of them you do cross out, like notes on crosses design. Yeah. Some of them you do like a gentle roll. So it depends on the pen, because they're designed slightly different, and you don't want to cause tears by going against the grain of the pen, essentially.
And I've seen you can get ones to do it yourself at home.
You can.
But I was worried about infection risk.
I have had, well, the infection risk, but I have had people who have come to me after doing it at home and causing skin damage, because if you're done at the incorrect depth or causing the whole concept is to cause micro damage, which sends that signal to your brain to stimulate repair and collagen and elastin production. But if you cause too much damage, then you've got your reverse pigmentation, you've got scarring. So yeah, a tricky one.
Oh, so best get it done by a professional.
Yeah, absolutely.
Okay, so and how long does that take to work? Again, a long time.
Well, it's a process. So if you think of it, when we're in our 20s, our skin is doing that naturally every 28 days. So all we're doing is emulating that.
Yeah.
And so if you do have pigmentation or scars, they take a couple of around 3 to 6 usually to start seeing a significant difference. But a lot of people get it without having any major pigmentation or scarring. They just do it as a way to emulate what your skin used to do when you were younger, and to keep up that fresh, hydrated look. It helps with toning and firming because of the collagen and elastin production. And again, as a preventative treatment.
Okay, and anything else you have done too?
I actually had a new treatment done 2 weeks ago. I had Sculptra done.
So I've heard of Sculptra and I don't know anything about it.
Yeah, so Sculptra is a PLLA acid.
Oh, good. I love PLLA. It's my favorite kind of acid.
So it's a collagen stimulating treatment. And
always comes down to collagen, doesn't it, ultimately?
Of course.
Yeah, sorry, go on.
Yeah. But the thing, all of these treatments do target collagen, but in different ways, different kinds of collagen. We have more than 28 different types of collagen in our skin, probably more that we don't know of. And each of these treatments tend to target different collagen and at different depths. How PLLA works is, so there's lots of different brands of PLLA on the market now, but Sculptra is one of the most widely known and one of the oldest on the market. So essentially it comes in a little vial, you mix it with 8 to 12 milliliters of water, and then shake it, leave it, the particles absorb the water, and then you inject it into the concept is you inject it into the area where you want collagen stimulation. So I have lost about 2 stones of weight in the last 2 years. So I was noticing a bit of sagging, and I've lost significant volume here, but I don't want dermal filler, personal choice. So I had it put into my mid face and then here, because I felt like I was getting a bit jowly.
All right. So how can it help your jowls there?
Because
I think that would make it worse.
No, it helps with the firming.
Oh yeah,
and essentially helps with pulling it all back very subtly. Not
so
like
for
filler.
Me and my jowls that I'm noticing that might be what I need.
It just helps pull that back.
Yeah, because when I did used to do filler, we used to talk about, because people often want it here, here and here, and we used to say actually you probably need cheek filler first to be like the scaffolding. Yeah, cheek and jaw actually. Yeah, and then once you do that, you often need a lot less here. Yeah, so it sounds like this is kind of maybe a better alternative to filler?
I think they both had their own place. If you've got significant volume loss, the only thing that will help non-surgically is filler. Yeah. And it's important to remember that filler is a really good treatment when done properly and in the right people.
Yeah. I do love a good cheek filler when I used to do it.
Absolutely.
Because it's subtle, but actually really makes a good difference. And that can help the tear trough actually as well, isn't it?
Yeah, it helps with that support. And there's nothing that can replace that. Yeah. So all these collagen stimulating treatments, if done early enough, like for myself, for example, they will help.
Am I too old?
No, I'm saying you've got really good cheek shape. So no, but yeah, filler has its own place, which I don't think there's anything else out there at the moment which replaces what filler does.
So Sculptra, you just inject it?
So you inject it using a cannula in small fans, what we call them. And the concept is once the water, your body resorbs that water, it leaves just the PLLA crystals. And them crystals are what stimulate an inflammatory response and the collagen synthesis.
Is there any risks?
Risk-wise, one of the main risks that is talked about a lot in social media actually is nodule formation. Oh. Because nodules are small clumps of collagen, which is why when we're dissolving the PLLA, we tend to do it at around the 8 to 12 milliliters of water, which gives that ratio where it's hyperdiluted. So, well, not hyperdiluted, it's adequately diluted so that when we are depositing the Sculptra, it's we're not leaving too many clumps of the PLLA in one place, and we do very small fans of the material, lots of small fans, again to really spread the molecules
To prevent
and
that
then
nodule formation.
there is a very solid aftercare where you have to massage the areas where you've had the treatment for 5 minutes 5 times a day for the 5 days after treatment,
Right.
just to make sure again that we're making sure the molecules are spread and to avoid nodule formation. But that's your main risk.
Yeah, because with filler, they often say it's not if you are a aesthetic practitioner, it's not a case of if you're going to get an ischemic event, it's when. So that means like you're blocking the blood vessel, which can be really dangerous.
Yeah, and absolutely anything you inject in, that risk is always there. It is there with Sculptra too. It's
right.
very small with regards to when we're using filler. And one of the things that we do to reduce that risk is use a cannula, because a cannula is blunt ended and theoretically it doesn't
penetrate the artery.
So that risk
and I guess
is
you'll
smaller.
have emergency treatment as well, just in case.
Yeah, absolutely. And being a doctor or being doctors, we can hold the stock for the emergency high lays or whatever we need to treat.
Yeah, so let's come back to that actually in a minute, because I think it's really important to talk about how to pick a good aesthetic practitioner, isn't it? Okay, anything else you have done?
No, that's...
I guess it must be tempting, eh?
It's so tempting. I always say...
And also probably helpful that you like, when you're talking to clients about, well, I've had it done and this is how I felt and things.
Yeah, I do get a lot of people coming in who tend to say, well, I want what you've had.
Yeah, you look great. And they're like 60 and they're like, yeah, can you look at 32? Okay. And then what, any other procedures or treatments you do that we haven't mentioned?
That I do?
Yeah.
On myself?
No.
Oh, in clinic?
Yeah.
So, polynucleotides, skin boosters.
What do you mean by skin booster?
I get my skin boosters.
What does this mean?
So skin boosters, essentially. So you have hyaluronic acid, which is your fillers.
Yeah.
But they're cross-linked, so they're like a gel molecule, so they replace volume, they stay where I put them. But your skin boosters, they're uncross-linked, so they're a liquid form of the hyaluronic acid. So essentially, the best way to describe it is the injectable moisturizers.
Oh.
But remember I told you for your neck, you were telling me, and I said Profiler would be really good.
Oh, this is Profilo.
This is Profiler.
I've heard the name.
Yeah. And so it helps really give you that hydration and helps fill the lines, essentially. Because one of the reasons why we start to look dull, dry, is because we're lacking the hydration in our skin. So that's where Profiler comes in.
That sounds good. Right. Anything else?
Oh, in clinic, skin boosters, polynucleotides, your toxins, derma filler, microneedling, chemical peels, Sculptra, and HIFU.
What? Say what now?
So HIFU is a device-based treatment. It's high intensity frequency ultrasound, and so it's delivered. So through the ultrasound waves, we deliver a heat pulse of 65 degrees to the tissue, and it helps with facial contouring and body, but most people come to me for the facial contouring, so like the jowls here, for example. And it helps tone. So if you were to go for plastic surgery for a facelift, what the plastic surgeon does is cut your skin, get to the SMAS layer, so your connective tissue layer, and use similar to what a heat probe is, and cause lots of small marks with the heat probe on the SMAS layer to cause contractions and tighten that SMAS layer. And then pull back, clip your skin off the excess skin, and cut it back, and that's your facelift. With HIFU, what we're doing is the only thing without surgery that can reach the SMAS layer through the ultrasound wave at that 65 degrees, and that pulse is what causes the contractions in the SMAS layer.
But then you've got to have the excess skin that you can't chop off.
Is chop off your skin. So therefore, again, picking the right candidate for the treatment. If you've got moderate to severe skin laxity,
it wouldn't be good.
It's important to tell the patient that obviously they can still have the treatment, but managing expectations, because plastic surgery isn't an option for everybody. But it's just managing expectations. They're not going to get a miraculous result. If you've got that mild to moderate skin laxity where actually you could do without, you don't need your skin cut back, then it's a great treatment. Again, it takes place over 12 weeks and the results last 2 to 3 years, because we have to remember we're still aging. So it's not that the results are diminishing or reversing, but we're continuing to age. So it's important to keep up with the treatments, whatever treatments we're having.
Yeah. And then I've seen other things where it's like people get kind of like, what is it, like burning?
Oh, like the carbon dioxide lasers.
Yes.
Yes.
What is this?
You don't do that? I don't do that now. But the skin resurfacing lasers, which essentially help with scars, pigmentation. But again, really important to go to someone who's got a certified machine and knows exactly what they're doing so that you're not going to get reverse damage.
So how do you find out? What questions should people be asking of their practitioner, or what should they be looking for?
I think
to get
one of the main things, again, when people come to me, they come to me because I don't look overdone.
Yes.
People go to the practitioners because they want to look like that.
Yeah.
I've noticed that.
Yeah.
So if your fillers is your thing, they will go to someone who they can see has a lot of filler because they think they know what they're doing with that. And the concept carries, if they want to look natural, they go to someone who looks that way.
Yeah.
Because it's aesthetics.
Yeah.
So people will pick their practitioner based on aesthetics.
Yeah.
And then, but forgoing that, the most important thing I think is qualifications. Qualifications matter.
Yeah. Do you think it's better to see a doctor?
I think
it's kind of controversial.
Yeah, it's very controversial. I do think, as much as people can say we've all done the same course, we haven't. We might have done the same aesthetics course, but we carry a lot of training behind us, which we carry into our day-to-day aesthetics practice. That's anatomy, that's physiology, that's pharmacology, and
hands-on surgery as well.
Hands-on surgery, but as well as complications. I know a lot of practitioners who will say, oh, go to your GP. Actually, we had one the other day, didn't we? With the when we were in clinic, we had a practitioner send someone in for managing the herpes after
oral cyclovir after
and
we said
treatment.
not on the NHS.
That's not an NHS thing.
Yeah.
And if you don't know how to manage simple aftercare or even prophylaxis, because we were discussing this. Yes, prophylaxis is a thing, but if you don't know how to manage that or where to direct the patient, I don't think you should be doing the treatment.
Yeah, I agree. And there are lots of great kind of advanced nurse practitioners out there and things doing it.
Absolutely.
But there's also beauticians or people get someone else to prescribe for them and things like that. And I think I wouldn't recommend anyone does that.
I do work with, in the area, non-medical practitioners, because they are doing it. So if they come to me for advice, I'm happy to give advice because I'd rather people are safe, and I'm happy to support them where needed. And there are some very good non-medical practitioners. But again, it's really important to see if they have that medical support in place if anything does go wrong.
Yeah.
And their training, well, all of our training, how many times we've done this procedure, what do we know the risks? Are we able to explain the risks to you? Because if we don't know how to explain them to you, likelihood is we don't know how to spot them.
Yeah. And I guess a lot of people look for personal recommendation, don't they?
Absolutely.
So I know you've said that, and I have a very limited list size now, so I say to my clients, don't tell anyone. I don't want any more people, because I'm very busy with other things, which is why I haven't reached out to do any more aesthetic stuff, because like you spend so much time doing your training, and I think you want someone who is doing that. If someone's doing all these extra treatments like you're doing, you want to make sure they're up to date, they're doing the training, and that's why I thought I couldn't do that, so that's why I stepped down. Is there anything we've missed?
I don't think so.
Well, that's good. It's very tempting to come, so maybe next time on my video I'm gonna look just gently different, maybe, and poorer. Brilliant. All right. Well, thank you so much. That was really interesting. I hope everyone has learned quite a lot. I think I have. Any questions, write them in the comments. I will try and find out. If I don't know the answer, I'll ask Sanam. And thanks for watching.
Thank you for having me.